Okay, this is off the cuff. I'm not sure exactly how my face shows. I don't care. This is to describe elder cleansing by SMOC, Southeast Medical Oncology Center, previously run by Dr. Atkins. And I'll use HENNY CARLISLE as the example. HENNY CARLISLE had a major sarcoma removed from her belly area. It was done by Dr. Gahara, an expert surgeon who has died in a truck wreck. But he did an expert job. But it turns out SMOC never did a follow-up. Not the first year, second year, third year, fourth year, or fifth year. Once they did the chemo, they declared her done. I do believe. I was there those years, and I don't ever recall her going to Southeast Medical Oncology Center, SMOC, in order to have the exams done to see if the cancer had returned. She was already too old, and I'm afraid Dr. Atkins appears to be part of the elder cleansing movement, and he retired out of it. But by not following up, he kind of marked himself as having put HENNY into a category that will die from the cancer if the surgeon didn't get everything removed, which is almost always impossible to do. So 15 years later, she finally got one of the tests, and she had metastasized cancer throughout her middle area, with the liver particularly affected by external nodes. They knew that at the time of the biopsies. The radiologist, Dr. Cragen, told us that day she was probably stage 4. What does Southeast Oncology and the pathology lab of Wayne Memorial do? Nothing. In fact, if anything, they send it to a place that's always backed up, Johns Hopkins, rather than sending it to UNC, which would have a duty to immediately bring it back. It took over 2.5 weeks to get the results back. During that time, of course, the stage 4 person gets worse. She went into liver failure. He did not see her at all, other than when we demanded to see him, because she had thrush. He treated the thrush. Well, no, he didn't exactly treat it. He walked out of the room and didn't say what he was going to do. A few minutes later, his nurse comes back with the computer printout of some prescription. We were down in the Clinton office, so we drove back the 50 miles or so to Walgreens, and I found out that it was a palliative. It was a painkiller. It was not a killer of the fungus. The pharmacist said there is no way this will do anything but make the patient relieved and allow the fungus to continue growing. That sounded like he made a bad mistake. I called the nurse that very afternoon. It was very unsuccessful, because she said that's his only prescription that he's ever used during the time she's been there. So he only uses a palliative, and he lets the patient who develops thrush, usually an elderly person, have something that might help kill them. One of the 1,000 cuts that you would need if you were healthy, but you only need about 3 or 4 or 5 cuts if you're not. So she said she'd get back to me. She never did. I managed to get a prescription from a nurse practitioner from her surgeon the very next day. We got it under control immediately. The curative immediately did away with the thrush that the palliative didn't touch. So the thrush that we could see was taken care of, and we continued taking it for the 2-week regimen so that she would probably get rid of it. So in any event, that's one indicia of a elder cleanser. Number 2 indicia was the unwillingness to make sure that his stage 4 people got immediate pathology results. He says stage 4 often take 2.5 weeks. No, they don't. Not if you're competent. Not if you care about your patients. You will force UNC, Wayne Memorial Hospital Pathology Lab, to send it to a place that guarantees a turnaround that will get it all done within a week. He does not even think to say he'd do that because he doesn't want to turn around within a week. The pathology lab, I think, intentionally sends the elderly stuff to these places that are backed up rather than a place that will do the turnaround. That's another major indicia of being an elder cleansing SMOC and an elder cleansing pathology lab of UNC. UNC is in on this to some degree. WMH, Wayne Memorial Hospital, UNC WMH has a problem because you don't take 2.5 weeks for the pathology and you don't fail to see your patient in between. It turned out his patient had gone into liver failure. She was not yellow, she was dark yellow. And her children just left her. Her children flew off that day, April 1st, they flew off. And she had no appointments, no nothing. On April 2nd, I got the nurse. She said it'd be 10 more days. I said, nah, we see you today. She said, no chance, he's busy. We see you today, I said. She said, well, we can see you tomorrow at 10. And I said, I guess that will have to do. He saw her. She was basically dead. Yellow, dark, so yellow it looked like someone who was on a table, dead. So he didn't even discuss the possibility of not doing it. And rather than 10 days, the next day, she got 2 of 3. But they don't work Saturdays because this is not a professional group when it comes to curing people. But it certainly is one that will kill you. You don't have to work Saturdays to kill the patient. When they're at the edge, they push them over. So, what's the final stage? The final stage is he actually, I believe, is the one that got the son to idiotically use a crowbar to break into our home that I'd lived in with her for 16 years. It wasn't idiotically, as it turned out. The SMOC had enough of the police department that the police officer, Canine Officer Harrison, confirmed that once he's inside from Virginia, you're out, even though you lived there. You lose everything. I lost all my financial records, my Medicaid, my Medicare cards. I lost clothing, suits. I lost a lot of photos. Some unreplaceable. He ended up getting control of the storage that Henny and I had set up so I could move my stuff mainly out of her house that she had set up in her name that she would never use. Well, he now has it. He can have it. He can destroy my family heritage. I want Henny to live. So in any event, he's in there. And he does not get, the first treatment worked. It kept her alive even though she was a dead woman walking when it started. The yellow went down, the liver began working, and now they have made the decision that the second treatment might just kill her. So we're going to sedate her. We're going to sedate her for the rest, and she'll die from stage 4 cancer. That's insane, of course. She wanted to fight. We had been talking fight for the entire time I was there. She was not going to lay down and die. Well, that's what they did to her, except she's sedated. Unlike normal people who have incurable cancer, they get a morphine drip, sit up in their hospital bed and meet people and take the drip when they need it. She doesn't get to talk to anybody. If she did, she'd be pointing the fingers at her son, her daughter-in-law. She'd be pointing fingers at a lot of people, including, of course, Jason Boyd, SMOC. I say this is how you do elder cleansing. It's rare that you get a child willing to kill his mother, but that child was a beast. He's been threatening my life for 3 years now. He's been over more than a dozen times telling me in front of his mother, let's step outside and settle it. The fat man weighs 250 pounds. He lowered her temperature down to 71 degrees in her house, freezing her, and then he left after I'd been there, and he said he was going to take care of his mother. He left within the hour, did not tell me. She had to call me saying, Sammy, I'm alone. And I said, I'll be right there. I cannot believe that he would be such a monster beyond what he already was, but he is a monster, a killer now, killing his own mother, but it's going to look legal. And Dr. Boyd will have all these nurses saying he's such a wonderful person, all these patients that he has cured. But this one he ain't curing. and he's done all the terrible things. I've said, oh, one less terrible thing. She came to his office after the chemo, had the natural diarrhea. For 2 days, Leon and his wife did not treat it. They let her get weaker and weaker. I show up, do not hear about it until she has it again, right before the moment of the appointment. I get her Imodium, I get it started, but she has an accident in his office. That time, I think he knew that she was going to be in big trouble. So that time he excluded me from the office, but he got her to DNR, do not resuscitate, rather than clean her up. He never cleaned her up during the entire 30 minutes she was sitting in her diarrhea. I didn't know she had diarrhea, but I did get in there. He separated me again, this time putting me on the far end of the room so I did not smell her. She smelled awful. And then I explained to him that was not an informed consent DNR. He said, I've got it already, it's too late. So we went to the hospital. He would not allow an ambulance. He would not allow her to walk out dripping diarrhea for about 30 feet along his hallway. He didn't tell me that, but that's why he wouldn't allow it. He got her in a wheelchair. When she got into the car, I smelled something that you have never smelled. Diarrhea inside a closed car. It's awful. And so I asked Henny, what's the matter? And she broke down in tears, and it came out. So we got to the hospital. There were no nurses waiting like he promised, but I immediately demanded a nurse, and I immediately got a slip of paper from Tyler, L. period, and I immediately retracted the DNR, using Leon to have to be there for her to ever give an effective one, not knowing Leon was a bigger monster than I knew him to be. So ultimately, I had a much more detailed informed consent conference determination, but others of Mrs. Carlisle's circle got bought into the Leon's version that the DNR is what she wants, and they had taken control of her. And she said, after she accused me of things, of course I couldn't have done, wouldn't have done, and actually did, only because I was her caregiver for basically all the time she needed care. She said, did I get it right? 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 To 4 different directions. Got her head off the bed and said that, saying, I'm being coerced, help me. The FBI has done nothing. That's how it works. You end up getting the authorities to either be incompetent or to be in on it. That's how you elder cleanse. Do you want your grandma elder cleanse? Do you want your father or mother elder cleanse? We have to begin to stop it, and stop it here in Wayne County, North Carolina. Do something. Go to Bryant Kittrell Facebook, BRYANT KITTRELL, and post and demand that the FBI National send out a healthcare fraud team. This is healthcare fraud of a sort. The first thing that number one thing they're investigating is harm to the patient. Hey, you can't get any greater harm than what they've done to Henny. They put her in a coma so that she can die from stage 4 cancer, rather than do what she had absolutely wanted, and that is keep doing the chemo and hope for the best. It worked the first time, and therefore they couldn't give her a second time. They said it's too dangerous the second time. The first time she was liver failure. Why wasn't it dangerous then? America, wake up. Stand up. Give up your apathy and go after corrupt doctors, corrupt lawyers, corrupt cops, corrupt sheriffs, corrupt hospital officials. Go get them. Come on, America. You can do it. Thank you. I will be posting over and over again, and it will be extemporaneous. I can do that reasonably well. Not perfect. I don't want a canned speech. So somebody do something big. Thank you. Bye-bye.